Thanks for the invitation, Professor. It's an honor to be here with you and in this very nice event. And I hope we all enjoy these next few minutes that we are going to share a little bit of our work here in Spain. We're going to be talking about aesthetics and biology and how to be as much conservative as possible when performing aesthetic treatments. I think it's a very nice topic because when we think about aesthetics, we sometimes forget about biology. So we are going to be talking about how to meet them. I would like also to thank my teamwork, like people from Be First Fit for First Fit, and who develop all this work with me. So let's go and let's have fun a little bit. So what we have prepared for today is talking about concepts that will help us to understand actual dentistry. So what we are doing nowadays and why we are doing this way. And we will also travel a little bit to future, where we are going to understand technology, how it happens to make our lives easier and better. After all, I hope you can choose where to go, being in the present or traveling to the future. So this is going to be my invitation for the end of the journey. So the present, we are also talking about digital era. So we are in the digital time, everything has changed. So we have nowadays a new world where things has changed. So the world needs some rules now, so everything is faster. People are losing their jobs because artificial intelligence is doing much and much more things, but more jobs are getting available also in new things. So it's faster, but unpredictable, but full of opportunities. If you know how to behave yourself, you have a lot of opportunities to join. The artificial intelligence, I understand that comes to make our lives better and to enhance human capacity, but without disregarding humans. This is a topic that I would like to talk about because people are thinking that artificial intelligence is going to substitute humans, but I believe if we know how to use it, you're going to be part of the process and you're going to join very few and good moments where you are going to be very useful, but you need to change your mind and know and understand how to deal and to interact with AI. So this is the deal for today. This is the challenge for today. Even for the people who are going to a restaurant, they need to know about technology because we cannot order food if we don't know how to manage a tablet or some computer or some new technology. So the question is, how much time do you think we still have if we don't change our minds? So how much time conventional dentistry is going to be able to feed you? So I think very short period of time. So we need to understand things different and change our minds. So when we talk about aesthetics, that is my topic, and the history, so it's not something new. It comes from time ago where human needed to perform some aesthetic procedures to change the aesthetic of something in the body or in the smile. When we talk about the smile, the aesthetics should be something to help us to change color, to change the shape, to change the alignment, or to correct some cracks or crack the tooth. It means some cosmetic imperfections, not only to help the biology, but sometimes just for cosmetic procedures. And that's why it's a very challenging thing to perform aesthetic procedure without messing up the biology. So we're going to understand this, and these things started to move on or to have the protocol that we have today, I bring a history for you that it comes from 1928, where Charles Pincus worked with the movie actors, and they needed to appear beauty in the recording time. So here you see Judy Garland from Wizard of Oz, where she didn't have a good smile, but she needed to appear with a pretty smile while recording. So they used it to have veneers, like a veneers plastic, putting on over the tooth. No cementation could do it by that time. So the patient or the actor used that thing just for recording moments, and then she needed to remove to perform normal life. Time ago, we know about all the studies about Michael Bonocor, 1955, where he started to develop all the researching things about acid etching in the tooth. So this made us change a lot of things in dentistry. Also, time ago, we had the participation of Raphael Bowen talking and researching about BGMA. So another great discovering moment. Then we had Alan Rochette talking about the use of silanes for bonding ceramic restorations. This time ago, in 1963, we were talking about it. And then Dr. Scalamia and Simonsen in 1983 talking about etching the ceramic to have a better surface to cement. So all of this, if we see the history, we had changings time by time to be able to do what we do today. So adhesive protocols to be as much as less invasive to the patient and proceed the aesthetics that we need to proceed in the treatments. So we also know the considerations for veneers, for crowns, for any kind of preparation, that the biology, we should respect the tissue, because the enamel, we always have to agree that the cementation and the bonding over enamel is much better and easier and with higher values than indenting. So this is the issue. How can we preserve this tissue when we need to perform a treatment where we need thickness for the material? So we also know that the success rates decreases when bonded to the dentin surface is done, and also decreases more if the dentin is contaminated. So this is the hard part of it, because if you see the cervical areas of the tooth, we have very thin layer of enamel. So you just touch with the burr and you have lost the enamel that you have. So how can we start to design a smile with some drawing that we do, and how can we respect the tissue that we have underneath? So the art of it is beginning with some strokes, but carrying the detail and the sequence. This is going to make difference in the end of it. So you need to care every detail from the beginning to the final moment. So remembering where you begin, that is going to help your patient to understand the outcome that you have. So video and photo documentation is going to be very necessary to perform all of these treatments. So it's also essential for you to keep situation under control and to understand what happened during the treatment. Once you touch the tooth, you don't remember anymore where did you start it. So it's very important to document and to have photographies to understand what is happening, and especially because patients sometimes forget where we started. But this needs to be made like from beginning. So we need to promise this kind of results to the patient, and then we need to understand how we are going to perform to proceed in the clinical area, and then we need to end up with the results that we promise. So the expectations of the patient goes through directly to the result that we have. So this is going to be a successful treatment, but it's very hard to perform because all the aesthetic treatments, we have several steps from the beginning to the end. So sometimes it takes time, it takes a lot of steps. So if we lose the control of the things, we end up doing things that doesn't achieve the expectation of the patient. So it's the most common problem in aesthetic procedures. And if you fail, just don't worry, but try to have things under control to understand why did you fail. Like in this case, you can see that we needed to change the color too much, but we did less preparation, trying to avoid and trying to save biology, but we end up with the result that is not correct for the patient. So here is the issue, how we are going to manage biology to match the aesthetics that we need. This is the challenge for the aesthetics procedures. So if you have things under control, you document your case, you can work on your mistakes and you can learn from them to evolve your technique and try to end up always better and understand that the success of the treatments is going to be not only from the outcome, but also from the time. The patient needs to keep that result for long periods of time. So this is the success. The success is going to also depend on the balance between how much preparation we do, which is the material that we are choosing for these cases, which is the substrate that the patient has, the color and the quality of it is going to count. The thickness of your material is going to also have a very important paper on that, and also the translucency of the material. So if you see all of that, it's very hard for a human to think about how to manage all the steps and try to be perfect in the final of the treatment. So that's why these type of treatments are done only by expert surgeons or people who have been working long period of time. No? So you need to be expert because you need to understand about material preparation, bonding, so everything function, biology. So this makes with time. So getting to know the preparation, how much you're going to prep is very difficult in this kind of procedures, but you always have to have in mind the final shape of the veneers, the final shape of the crowns, because this tooth needs to have a proper reduction to have the thickness of the material controlled. So this is the kind of thing that is very, very hard if you don't have any digital control, because you prepare by hand, you can have thickness, bigger thickness in areas and thinner in other areas. This is what is going to make your treatment last more or less depending on how do you perform them. So the criteria that we have for veneer preparation are always that if we keep an enamel, we are saving biology and we're making easier our process. So from time ago, we have developed several systems in how to control the thickness of preparation. So you can have calibrated burrs where you have the measurements of the reduction that you are performing. So you know when you grind this tooth, how much you are grinding out. So you know because the burr is calibrated. You have several models in the market. We can also use a silicone index, a silicone guide from the workshop. So we do the workshop and then we do a guide to perform a control on that in the mouth. This is how it's hard to perform, because I want you to think about how can we control a 0.3 preparation using a silicone that is flexible. So it's very hard to be precise. You can have a control, but it's not a very precise control because the silicone is not a hard material that you can really measure. And this is a visual control that you have So visually you can press more or press less the silicone guide, so you have difference in the control. We have several studies that we see different operators using the silicone guide to control, and different preparations end up in the final because they cannot control precisely. It's a very good way to do it, but it's not precise. So to be predictable, we need to understand that, first of all, we are going to think about the aesthetics that we need to achieve. We are going to perform a mock-up in this patient because this is going to be our promise where we are going to finish the treatment. So it's very important to take care of the mock-up part, of the design part. And also, we're going to think about the design, thinking about how much material, how much thickness do we need to have for the material that we chose. So all of this we're going to think before preparation. So another thing is doing the mock-up. This is a technique described by Galip Grell, where we prep over the mock-up. So here you need to perform the mock-up, adjust the mock-up. Once the mock-up is perfect and you know that is the final outcome that you want to achieve, you're going to measure with the burrs, and using your hands, you're going to prep. And here comes the issue, because you're going to use your human hands to do the prep. So if we compare same patients, same mock-up, different operators, we're going to have different outcomes in thickness. So this is not predictable, as we need to be nowadays using great technology that we have available for us. So we have described it also in the literature, printing some guides where we have this kind of windows and part of the tooth comes out. So we know that we need to prep those areas to try to be as much conservative as we can. So this is technique. But here again, we have the guide, but the person who is hanging the handpiece is a human. So if you compare different operators, you have different outcomes because the human is doing the work in there. So it's hard to be so precise in there. So let's see how we are going to do to protect and to understand that the biology of the teeth is going to be respected, keeping as much tissue as we want, and also doing changes in the aesthetics before proceeding the preparation. No? So this should be. So the question is, how much do we prep and which aesthetic outcome do we have? So this is a thing that if we don't use digital technology, it's very hard to give good result to the patient. So what we promise is going to have different in the end. So if you want to promise something and really have the same outcome, you need to go digital, and you need to prep also digital. So what we do is we perform the mock-up digitally, we do the reduction digitally, we measure that, and we see if we respect the tissue that we need to respect. If we don't respect because we are grinding too much or we are losing too much tissue, we have several options to do it. We can also perform orthodontic treatment or moving this tooth before preparation. We can change the aesthetic of the mock-up, like giving more volume in some areas. If we are able to, we can change the aesthetics, like making that to match the biology. So we can do it because we can measure it. So we have in the screen the initial situation and the mock-up, the design situation, and also we are prepping digitally to have the final situation inside the computer. So this is what has been described, and we are doing nowadays with the technology by first fit. For you to understand, we can perform treatments like this, where we go for from a very, very dark color to a very white color in a very small thickness. But for this, we do all the preparation digitally, and we choose the material thinking about the preparation that we are going to perform. So we can perform this, and also very short period of time, the patient has all the treatment conclude in very few appointments. So the procedure starts taking digital impression. Here you could also take normal, a conventional one, and the lab is going to scan, but I prefer to do all the digital workflow from the beginning, because the communication with the patient and with the lab is easier, faster, and better, and also more predictable. Here you're seeing the Trios scanner, what can make a full arch scanning in less than 2 minutes. So it's very easy for us to get this data from the patient. So once we have all this data, we have the X-ray, we have the scanning, we're going to decide which aesthetics is going to match the expectations of this patient. And we're going to show him without touching anything. I'm going to show a 2D smile design. He's going to give me a feedback. I will change if it's wanted for match his expectations or not. And then we are going to transform this in a 3D situation where we're going to perform a mock-up. And when we accept the mock-up, we are going to copy this to the end of the result, but guiding all the preparation. So this should be your lab workflow, like managing all these files. So you need to learn how to communicate to your lab this way. And this is what your patient nowadays expects. The patient is expecting to see the result before you're performing it. But if you perform a very nice result in the digital, where you show in the patient and communicate, and you don't achieve that result in the outcome, you're going to fail. So that's why you need to control all the process to beginning from the final. Yeah. So what is first fit for? What is this technology for? I will show you a case where you're going to understand that it depends on you. The technology is here, but it depends on you. How much passion, dedication, commitment, and effort can you do beside just using the technology? Because you are going to use it, but how much passion you're going to use to really understand that you can make your life easier and also your patient's life easier. This patient is a girl that doesn't like her lateral incisor, the 12. She doesn't like because it's small, it's a little bit backwards, and also she doesn't like the color. But when we see the smile, we can understand that have more things to be in there to understand. So we do an X-ray, some photos, some videos, and we understand that more than the lateral needs to be corrected, or should be at least proposed to be corrected. So for that reason, we perform a video before the pictures. So here I will understand the smile of the patient, how dynamically works her smile. So I will be asking some things like, what is the reason for her to be here? What she doesn't like in her smile? What she does like in her smile, so I know things that I need to change, and I know things that I need to keep. How can I help her? It means which final outcome she is expecting to have. So she tells me that she doesn't like the lateral, but she would like to have tooth with more equal, more rounded shape, and so different color. So I cannot act only the lateral in this case, because she has a higher expectation than just correcting just the lateral. I also question for the patient is, what means a perfect smile for her? So she tells me what she has in mind, like the perfect smile that she would like to achieve. And then I tell her also if she does agree in doing several or these kinds of procedures. So I think about the procedure that I'm going to do, and I explain the patient before she goes to the treatment. So this is called data collection, where we are going to spend a lot of time here, and all the time that we're spending here is going to be saved in the final, because it's time that you're going to help you plan the treatment design and really match the patient expectations, but also thinking about how can we protect and how can we respect this patient biology. So these are the kind of videos that I do. I do a video that is an interview, and I do a video that is patient counting from 50 to 60. This way I can get to know what the patient wants with the video interview, but I can have also a video that can be reproducible during the time. So when I end up the treatment, I do the same video and I can compare if I end up with the results that I needed. Usually I use mobile and reflex to do all the documentation. We need to take care with the mobile documentation, because if we get too close to the patient, we're going to distort the image. So what we are going to do, we're going to go 1 meter far away, and we're going to close up with the digital zoom to have the perfect video in focus with the smartphone or with the video camera. And then once we understand the dynamic that the patient has, we're going to try to capture this smile from the patient in the picture. I can also work in the video, like going back and forward and looking for the moment that I need to understand, like some phonetic references for the aesthetic design that I will proceed. So this is going to help me to take decisions, but I also use the picture and the photography because it's easier to communicate with the lab. So both things, video and photography, to perform this kind of treatments. These are the pictures that I try to have in all the cases. A relaxed picture, a smile, a maximum smile picture that is very hard to get this picture, because sometimes patient has some complaining about his smile or her smile, and she doesn't smile too much. So that's why we do the video before. We also do a picture with the retractor to understand how the tissue is inside, and a 45 picture and a 12 o'clock picture. These pictures are going to help us to work in a 3D environment. Once we do all the pictures, we are going to actually work in few of them, but we understand the treatment looking of all of them. No? So finding the correct position in the head is mandatory for these treatments, because different smiles you can design if you have the head up or if you have the head out. So the patient needs to be with the head straight. We need to help the patient to keep that position and to try to capture the moment. So you can also think one thing, it's easier and better for you to erase pictures than missing one that you haven't done. So that's why we use digital technology to perform a lot of pictures, then we erase the ones that we don't want, and we just keep the ones that we are going to work to. So once we have our picture, we're going to work firstly in the computer, resizing, working with this picture, understanding and making lines to understanding how is the face of the patient, so we can also see the patient by one side and the patient by other side, to see where the face is more developed, so where the smile needs to go. So this is going to help us to design the smile, to understand the symmetrics and the asymmetries of the patient. We need to understand that the goal for us is trying to match a perfect smile to this face. So most of the time the patient is not full symmetric. So also the smile needs to be with some imperfections that could be a good thing to perform. But we need to know where to take these asymmetric designs to match to the face. This is good because we can spend as much time as we want, because the patient is has gone home, and now we just have all of this documentation to understand all of the issues that we can have, like how can we estimate, for an example, the width of the smile? So our friend Altamiro Flavio from Brazil also described this technique. It's one technique that I really like and try to follow a little bit, not as a rule, but as a basic principle to guide. So we draw vertical lines in the measure of the iris and distal of the pupil, and we are going to understand the width of the smile and how also the lip is going to be part of this aesthetic. No, so this is just a guideline. It doesn't need to be an obligation to follow, but all of these rules described by Christian Coachman and described by these people, so can help us to perform a 2D design and talk to the patient. We are going to understand if this is going to match his or her expectation. If we don't match the expectation of the patient, we need to change and we need to go for something that really matches the expectations, but we need also to find the perfect combination in biology aspects. So that's why we can perform this, and then we are going to take to the mouth and we are going to perform what we call the mock-up. The mock-up is a moment that is worth for the patient, is worth for the dentist, where we're going to understand, we are going to motivate the patient, but we also are going to make the patient understanding the limitations of the treatments. So here, it doesn't mean that we need to do something or perform something just to motivate the patient. We need to perform something that we know we are going to be able to follow in the final outcome. So it's an appointment that we use also video and pictures, and it's really nice to see how the patient makes part of the teamwork, helping us to taking decision in where to go, what to change, what to do. So this is what we do nowadays, and respecting all this workflow. Once we have done this and we had the facial integration of the patient, we're going to take this mock-up to the computer and we are going to perform the preparation digitally in the computer. So I will reduce the amount of the thickness that I need for the material that I want to choose. That's why I need to understand and select the color of the treatment in the beginning, not in the end. So I need to know here the color that I need to end up in this treatment. So I'm going to perform the preparation digitally. If here I prep too much and I go to denting or I go too deep in the tooth, I can take two decisions: moving the tooth, moving the preparation, moving the tooth so I can move the preparation backward or forwards, or moving the mock-up and changing the final aesthetic outcome. So I can go and make a mock-up that meets biology. And I can also measure this in the computer before doing in the mouth. So here is the challenge. How do I take all these measurements to the mouth? Because we spend the time doing in the computer, so now we need to take to the mouth. So this is how do we do it. We use a first fit technology where we use guided reduction. This is the first case that has been done in the world where we use it man and machine. So we did conventional finalization by a technician, Luis Mampel, but we need all the preparation. We had all the preparation guided and mentored by Carlos Toro, doing all the computer design and preparation. So we had three professionals from different parts of the world. Carlos in Madrid, Ricardo Recena is in Malaga, and Luis Mampel is in Laurin. So three different parts and working together in a case to several guides are going to, so we're going to prep and reduce just the amounts that we reduce it in the computer. Here you see in a fast video how does it works. The handpiece just go like a lock key effect, so goes inside the guide, and you just can do that movement. You cannot do a different movement than that. So any operator is going to obtain the same result, because we are guiding the procedure. We are not depending on human. We are depending on the machine and helping by the human. The human is executing the technique, but the technology and the guide has a locky effect that is going to allow you to do the preparation just on the surface that you designed it in the computer. So you just lock the handpiece in there and you prep. For every kind of case, you're going to have different guides. So this is the kit that we receive in the clinic, several guides that we go prepping and changing to prep all the surface. To do a full arch preparation, we can take more or less 30 minutes, 20 minutes to prepare, and another 40 or 30 minutes to cement. So it goes really fast, the procedure, because all the work has been done in the computer. So here you're going to see how it works. So the handpiece gets locked in there and you just prep only the surface that you need to prep. So you control the part of the biology that you are removing, enamel or dentin, you are controlling digitally and measuring before touching the tooth. So these are very impressive technology that can make you end up with very thin and very reliable preparation, controlling the enamel and doing the minimal prep as you need to this case. So also you can measure different operators, and you're going to end up with very few error range, because it's controlled by the guide. So once you learn how to positionate the guide, all the preparation is going to be the same. So you do the mock-up, then you do the digital prep over it, you measure everything, and you understand what is happened by transparency. So I see the final shape of the tooth, I see the tooth that has been prepared, I can measure that, I can also see in the X-ray if I'm removing too much enamel or not, so I can have really controlled all the situation. So this is how we perform, and we measure, and we take all the work in the computer and less in the lab. So we do the measurements like side by side, and you're going to see the thickness of it. Here is how the guides are designed. So we do the preparation before doing the guides, and then you perform the guides. Then you print these guides with a very unique technology, and this is the control of it. And also an amazing thing that you can do, you can also prep and have the veneers before you start the preparation. So this is the amazing outcome that you have, because you're going to cement all the veneers using a guide, so you don't have, and you don't mess up the position of them, because you can control the insertion of it in the screen. So it makes really easy the cementation part of it. You are going to cement the veneers the same day as you prep, so you don't have contamination if you have exposed the dentin. So this is for you to understand what is going to happen is all the technology that you use it to guide in the lab, you're going to perform in the clinic, and in the same day, in the same moment that you prep, you cement the veneers. So it goes guided, the preparation, and just before getting the board, you already have in the table or in the clinic the veneers finished. So you prep and cement in the same appointment. So you can have some outcome like this, where everything has been guided. Your promise that you have in the beginning goes straight to what the patient expects. So the final outcome is something better for you, because you control more and you have a great result, and better for the patient because it's faster and easier, and you don't have also to use temporary restoration where you can have contamination in the dentin, so anything that you have. And here you can see the final outcome, where you can see very good aesthetics perform this kind of treatment. So this means that this is worth for planning, design, and also understanding everything. So it's worth for changing people's life, but also to respect biology. Aesthetic procedures are very hard to perform and to keep safe the tissue and to have longevity. So that's why we use this protocol. Here, I will finish explaining all the workflow. So we start doing some video and photos documentation, understanding what the patient wants, where we need to go. We're going to be also in contact to the lab and with all the technicians involved in the case. So trying to take the decisions before we perform the treatment. So this way we can take decisions and we can make changes if they don't go in the same direction of the biology, of the nature, of the expectation of the patient. So here you can see where we do the planning digitally. Here's Carlos Toro doing the planning with me. So all this guided design is going to be taken to the computer so I can measure. And now I will print the guidance after the mockup has been decided. I will print the guidance for the preparation. I will have the veneers finished before I prep. So once I checked everything and the patient gave me the feedback, first fit team comes and prepare all your kits that you're going to receive in the clinic. So you're going to have guides and veneers in the table before starting the procedure. This procedure is going to take you not more than 1 hour. Like changing guides and doing the preparation and cementing is not going to take more than 1 hour. If you compare to a conventional procedure where it takes 2, 3 or more time for prepping, trying to understand where you need to grind or you need to prep. So it's much more time and also less predictable for the patient and for the dentist. So this is how the procedure is done. It's locked so you can perform just what you have seen in the computer. You go really, really with minimal thickness. You just polish sharp angles in the finish, and you're going to do the guided cementation. First, you do the trying, you see everything is correct, and you just follow the conventional protocols with bonding procedures that we use it. So we use a Paralink aesthetics cementation here, and the guide cementation help us to have all the veneers in the position. So you can clean all the excess. You can use also a split rubber band if you want. Normally I don't do it, but you can use it also. You use the pinpoint from Ivoclar just to fix the veneer, and then you're going to remove the guide, finish cleaning your excess, flossing the areas that you have cement, and you have final cementation in the same day that you prep it. So it means that you sealed all the denting surface that you can have, or all the enamel, you sealed all of that in the same day as you prep it. So the possibilities of it really depends on you using the technology, but getting to know how to use it and taking advantage of it. So to finish, I would like to thank all my friends from First Fit, and I would like to tell you that you need to put your heart and all your effort in every detail. This is the secret of this success. Don't start if you don't know where to go. Invest time in diagnostic and planning. Don't waste time when you start the action, because this is a bad moment for the patient. So when you start the action, go really fast, because you plan it and you have a great job doing before in the computer, so you can do it fast. All the time use it in communication is going to save you time in the end. So proper communication with patient, proper communication with team lab and all the team that you have. Dedicate yourself to do something that you really like, okay? Because this is going to save you neurons. So it's a very good advice. Teamwork and be grateful, always, always, always. So conventional, it's good, but you can go digitally, you can control things different, you can have time save it, and you can have really different sensations from your patients if you perform things fast and predictable. So this is what we are doing nowadays. Things that we have to use 10 hours clinic, now we are doing in 1 hour. And I invite you to go to my profile in Instagram, Dr. Recena, or also to Be First Fit and find Carlos Toro in there, or find someone to help you to develop more this technology in your clinic. And the issue is here. You can be in the present, or you can also travel to the future. It's your choice, but the issue is, are you ready to use technology and increase your skills? So I really do believe that using technology, you can perform better treatment. So AI doesn't come to substitute us, it comes to help us. So this is my view of the dentist nowadays. I would like to thank you very much for this moment that you have been sharing with me, and I invite you to be in contact, and so we can share more impressions of it. Thank you very much. Thank you, Professor Contatineto, and all your team that in the background are taking care of this fantastic event. Thank you very much.